Thank you so much for the warm welcome. I'm so happy to speak with you all this morning. I think it's just great when, especially groups are thinking about men's health because as most of us know, men are probably not as proactive about seeking out healthcare as the women in their lives. So I'm really happy, and this is something I'm really passionate about. So thank you so much for having me on this platform, and I'm excited to talk with you this morning. So I will go ahead and share my screen and then I'll get going with the presentation. And I'm pretty, open if you feel like as we're going through, if you want to chime in with questions. Otherwise, maybe we'll wait to the end and just try to get as many, questions answered. I can share. Okay, just trying to share the screen here. There we go. Okay, can everyone see my screen?
Yes.
Okay, perfect. All right. So we're going to get started today with men's health. And I thought it was important really to talk about some of the most common, men's health conditions. We're going to have a reasonable component talking about prostate cancer, but there's several other men's health conditions that are also really important, I think, to be aware of. And I'm really happy to see women on this call as well. As somebody whose dad is a little older, and a brother and lots of men in my family, I have now become my family's urologist. So I am really excited that, women are also, part of the healthcare in their men's lives as well. So hopefully you have a good takeaway from this too. So this is an outline of some of the topics we're going to be talking about. So we'll start off with prostate cancer, followed by sexual dysfunction, benign prostatic hyperplasia, which I'll explain, hypogonadism, which is essentially low testosterone, and vasectomies. So in terms of prostate cancer epidemiology, prostate cancer is the second most common cancer in American men. It's the second leading cause of death in men in the United States as well. And about 1 in 8 men in the US will be diagnosed with prostate cancer. My screen over. Will be diagnosed with prostate cancer in their lifetime. In 2021, as of this year, it's estimated that almost 250,000 new cases of prostate cancer, with approximately 34,130 estimated deaths from prostate cancer. And this data is from the American Cancer Society. We are still really struggling with getting kind of global data because we know that, statistics and, epidemiology still has some catching up to do outside of some of the Western countries. So that's why my stats here are a little bit more US centric, but it's really because it's challenging to actually get accurate numbers for what these numbers are like in Ghana, for example, and other places. So this is just a graph kind of showing the trend in death rates from prostate cancer. So you can see that, starting in the 1930s, 1940s, when all of this, when we really started to get a handle on it, you can see an uptick in the rates of in the death rates. But then as you see the graph kind of fall off as we're getting now toward our current year, that graph is falling off, meaning less men are actually dying from prostate cancer. And why is that? We are doing a better job at diagnosing it. We have done a far better job in treating it. And compared to the 1990s and even other decades, we are not taking everyone's prostates out. We know that in the 1990s, people were overly aggressive with treating prostate cancer, but we have much better data to say, one, we can screen better, imaging. So there's other ways that men are really surviving from this compared to years ago when, like many other cancers, it was considered a death sentence. So I get asked a lot about risk factors for prostate cancer. And one of the top risk factors for prostate cancer are actually men of African descent. So every man on this call, by virtue of you being African, you have some slightly increased risk compared to your Caucasian or non-African counterparts in terms of prostate cancer. If you have a first degree relative with a history of prostate cancer, it also puts you at an increased risk. So this means if your dad had prostate cancer, your brother, these are important things to think about. So family history, we come from a culture that family history is really important to us. And so, in as much as we talk about, relations and how people are related, I really encourage people to have those hard conversations about medical conditions that run in your family. Um, Advanced age is also a risk for prostate cancer. So the older you get, you're at a higher risk for prostate cancer. And this is just because, as you get older for men, your prostate just keeps growing with time. It just keeps growing and growing. So you could think about if you have more prostate meat, so to speak, that's there, you have technically an increased risk of more of those tissues being potential nituses for cancer. So they did a study decades ago in Michigan, actually, where they actually took a bunch of like 80, 90-year-old men. They did their autopsy, they took out all their prostates and they biopsied all of them. And about 90% of these men had some detectable form of prostate cancer. And that number is fairly consistent across age ranges. So 80%, for example, of men in their 80s will have some degree of prostate cancer, 90% in their 90s, et cetera. So as you get older, it's not surprising that this may be found, but in general, prostate cancer is not, one of the most aggressive, cancers. So if you knew someone who was, let's say, diagnosed in their 70s or 80s, it's probably not going to be the thing that kills them, right? Unless they had an aggressive form of prostate cancer. And aggressive prostate cancer tends to show themselves a little earlier. So, I've had patients, that I've, diagnosed in their 40s or 50s, and those tend to be a little bit more nefarious. But typically, if you're older, and it took that long for prostate cancer to declare itself, it's probably more so related to you just being older. Now, I mentioned this in terms of inherited genetic mutations, and it's also important for the women on this call, or if you have women in your family. So breast cancer, prostate cancer, colon cancer, pancreatic cancer, they actually all cluster together in terms of their inherited genetic mutations. So for the men on this call, if you have a ton of women in your family with breast cancer, I really encourage you to think about if you have access to genetic testing and some way to figure out if maybe you are a carrier. So BRCA1 and BRCA2 are two of the most common genetic mutations associated with aggressive forms of breast cancer. Lynch syndrome is also another inherited genetic condition that puts you at increased risk for cancers. But I think even though you may say, oh, hey, no one in my family has prostate cancer, if you have a pretty significant rate of breast cancer, and I'll mention it again, breast cancer, colon cancer, pancreatic cancer, they all tend to run together with prostate. So if I see a patient, and I always ask about family history, but if someone tells me, hey, my mother, my four sisters all had breast cancer, I really encourage them to think about genetic testing. And this helps you to think about not only your own kids and maybe what risk they need to be aware of, but for the men, if you are younger than kind of the standard prostate cancer screening age, is something that helps me to think about, hey, maybe we need to start screening you a little bit earlier than like the average male. And our American Urological Association, which is the largest kind of interval of prostate cancer is probably not, again, going to be the thing that gets them. So in terms of the future of prostate cancer screening, there have been a lot of advances in prostate imaging with MRIs. And this has really allowed urologists to better select patients who need biopsies and stratify them for what we call active surveillance versus intervention. I won't delve too much into the nuances around active surveillance, but it's essentially a technique where we know you have prostate cancer, low risk prostate cancer, and we're not necessarily running to treat you because low risk prostate cancer, again, has a low risk of kind of progressing to something more aggressive or, what have you. So we monitor it closely, but in someone that has really low risk prostate cancer, it doesn't necessarily mean we have to jump into treatment. I know that's easier said than done for a lot of people because living every day, potentially knowing that you have cancer may not be something you want to sit with. But because we have so many advances in imaging and other treatments, it has allowed us to be a little less aggressive with intervening for all prostate cancers. And, again, something that should be a conversation with your urologist. And imaging may soon become more of a standard of care of prostate cancer screening because, as I well know, and probably is something you've discussed, prostate cancer screening not only involves the blood test, but it also involves a rectal exam. A lot of guys aren't comfortable with the rectal exam. I do many rectal exams a week, so I have to have this conversation a lot, but it is important to kind of have both pieces of information if you're really trying to screen someone. But we also recognize that that is a barrier for men getting screened. And also advances in the genetics of prostate cancer may play a more prominent role in assessing patients that have risks of high-grade prostate cancer. These are all things that are in the pipeline in terms of prostate cancer care. So I know that may have been a lot to digest, and again, happy to have us have more of a discussion after the end of the talk. But that's kind of the end of our piece around prostate cancer. So I'm going to switch gears a bit to sexual dysfunction, also something that a lot of men and women care about. So there's different types of sexual dysfunction. So when you think about sex, it's really a cycle. It's the interest and desire component, then the arousal component, followed by, your, erection, and then the orgasmic phase. So when we break down every cycle of sex, there's dysfunctions that can happen all across the spectrum. There's hypoactive sexual disorder. In the arousal category, there's erectile dysfunction, premature ejaculation. In orgasmic dysfunction, there's delayed ejaculation and even having no ejaculation. Erectile dysfunction is the most common of the sexual dysfunction, so I'll spend a little bit more time on that, but I see and treat all of these dysfunctions, and these are all things that, can certainly happen. So the strict definition of erectile dysfunction, or ED, as I'll abbreviate, is the inability to achieve and maintain an erect penis adequate for sexual intercourse. It's one of the most common medical conditions, actually affecting over 50% of men between the ages of 40 and 70. I see a lot of men under the age of 40 that have erectile dysfunction as well. So this is not just a disease of like older men, and it's it stems from a range of various factors. So for the younger guys on this call, I'd really encourage you, the things that you do to your body when you're young, they come to rear their ugly heads when you are older. So if you don't take care of yourself, unfortunately, ED is probably one of the many things that not taking care of yourself, how that's going to manifest in, as you age. Now, the burden of ED is quite significant. It's estimated that over 320 million men worldwide will be affected by ED in 2025. And again, when we think about these statistics, these of course require men to actually report that they're having issues with this. And we still are probably far underestimating men that are having issues with their erections because they are, maybe too embarrassed to actually report it. Now, causes of ED. Vascular causes are certainly one of the most common categories that we see that cause ED. So diabetes is a huge risk factor for ED, any kind of kidney disease, prostate removal or surgeries, traumas, liver disease, pelvic surgeries. And this really stems from the fact that you really need good blood vessels in order to have a good erection. Things like diabetes, renal diseases, those all affect your blood vessels, and that's how you end up with ED. Liver disease causes ED because your liver is what makes a lot of molecules in your body, including some important components for testosterone. And so if your liver is messed up, you are affecting your hormones, which are secondarily affecting your erections. Pelvic surgery is affected again because of the blood vessel supply. And although I didn't go into depth with this, if you take out your prostate or if you have surgery, you can have either temporary or potentially permanent ED, depending on how severe your prostate condition is. And it's only because the nerves that run behind the prostate are responsible for erection. So depending on if you had prostate cancer or something, how severe that is, most times, especially in current times, we are able to preserve those nerves. And so guys may temporarily have issues with ED, but we are typically able to recover that function. But if you had really significant prostate cancer and the nerves were just not able to be salvaged, then that can really cause some major issues with ED. Some neurogenic causes, it also include diabetes, alcoholism, spinal cord injury. If you think about all the nerves in your pelvis that are also required for you to have a good erection, if you have anything that affects that, that can be an issue. Diabetics, if you know anyone with diabetes, people with poorly controlled diabetes have tingling in their hands and their feet. They can also get that in their penises. And so that can cause ED. Hormonal causes include low testosterone. I mentioned before, even linked to, liver disease and things that are all part of, your body seeing normal levels of testosterone. But testosterone is something that we regularly screen for. If I have any patient with ED, I'm always checking their testosterone. Your testosterone levels actually taper off as you get older. So it may not be something that you did directly to, mess it up, but every guy has a different baseline for the testosterone. And if you have a relative change over time, that can cause issues with ED. Next big category are medications. So antidepressants, beta blockers, which are used for blood pressure, diuretics, and pain medications. Now, I always like to mention again, something like a beta blocker, which is used for blood pressure, you should not be sacrificing your blood pressure for your erection. So please make sure that if you're not alive without a good heart, you can't have an erection. So I think certain conditions really need to, take precedence over it. But we also know that, some of them are kind of bigger proponents of this than others. So if you are on a medication that you are pretty certain that the time relationship coincides with you having ED, it's always good to have a conversation with your primary care doctor to see how you can adjust it so that you're not, you're still helping your blood pressure, but you're not bagging your erections. And then finally, psychogenic. Sometimes even if I do a big long workup, I don't find anything organic that's really causing the ED. And psychogenic can also stem from a variety of issues. For younger men that perhaps were not sexually active until they got married, they really don't have experience having sex. So when they actually start, engaging with their partners, it is something that they really don't have experience in doing. And so psychologically, it can be an issue. If you have a new partner, maybe you're nervous about the sexual encounter, and that's causing you to have issues with ED. And if you've also had a partner for a long time, relationship dynamics change over time. If you've been married 40, 50 years, what your sex life was like when you were 25 is not going to be the same as when you're 60. And so recognizing how the different settings, different life changes all impact ED, I always encourage, guys, if you have partners, have these open conversations. And I didn't go into depth about female sexual dysfunction, but just as much as you may be dealing with this, female sexual dysfunction is very real and prevalent. And, the more conversations you have with your partner, you guys can kind of both come to the table and figure out the best ways to maximize your sex lives. So in terms of treatment options, lots and lots of options for erection. So I think, as someone who, again, lots of men in my family and lots of friends, there's a lot of things out here on the market for erections. A lot of people are selling what I call snake oil in terms of things to help with erections. But it always surprises me that men are easy marketing targets, especially when it comes to erections, right? Like there's things in the gas station, when I'm in Ghana, there's always some tonic on the bus that helps with everything under the sun, including erections. There's always something, but you really want to be mindful of what are in, things that you're taking. A lot of times, things that are over the counter or things that are gotten from questionable sources, it's a concoction of different things. And you don't want to just put anything into your body to help with erection. So I really do encourage people to not just talk to your friends, don't take medication from your friend's cabinet that they said worked for them. See a doctor. It's a medical condition. And so I know it's a sensitive topic to think about, but it is important that you get help, especially if the underlying cause are some medical things that need to be addressed. You may be chasing your tail if you're just kind of putting a band-aid on the problem as opposed to us really finding out what's causing it. So in terms of treatment options, lifestyle modifications, that's the best thing you can do for your body in most instances, right? So just, a good diet, exercising, managing your disease as well. That's the best thing that you can do for yourself. Hopefully for the younger guys on this call, if you don't have things like diabetes and hypertension, take care of yourself now so that you don't develop it. When I mention a plant-based diet, a lot of, of course, my only point of reference are, Ghanaian foods, which I love and which I make, but a lot of our foods are actually relatively healthy. And so if you think about ways that you can, optimize what you're cooking at home, minimizing fast foods, one thing I'd say, and kind of our cuisines, I really try to minimize like palm oil. Palm oil is very fatty, high cholesterol. So I try to minimize that if I can. Having lots of vegetables, right? You don't want to be eating a mountain of meat every single day, but you just want to really switch up your diet so your body is getting a good balance of, those fruits and vegetables as well. In terms of oral medications, there's a lot of options for those as well. I've listed them here. Most people have probably heard of Viagra and Cialis. And these are things where these medications used to be actually quite expensive years ago. They're all generic now. So I would say most guys can get Viagra or Cialis, at least in the States, for like 10 to 15 cents a pill. I have spoken with, colleagues and friends of mine who are based in Ghana, and I know that these medications can be a little harder to come by, but they're a baseline not very expensive. And so if it's something that you really haven't tried, I would definitely recommend this over something you would find, again, in a gas station or something that your friend found online that they want you to try. Okay, they work well. And there's something that we have also a lot of good data around how they work. And these medications, essentially, what they do, they help to relax your blood vessels. And so they maximize blood flow to your penis. And so all of them play on that reaction that happens when you're having an erection to prolong it. And so they work pretty well. There's also vacuum erection devices, which you can find online. If you Google it, you'll probably come across it on some, lewd websites, but you can get it on like Amazon or, a sex store, adult store, what have you. But vacuum erection devices are mechanical ways of keeping blood flow in your penis. And you can use it in combination with if you have a good diet or other medications. So I think it's actually really underutilized, but vacuum erection devices work really well. And if you, use it before you're going to have a sexual encounter, it again helps you to prolong that process. There's also, gels that actually go into the urethra that help to absorb into, the penis that helps to relax those blood vessels. There's injections. There's penile prosthesis. I put in penile prosthetics in men. That's really for end-stage renal disease. And it's an entirely internal device that allows you to, on demand, have a 10 out of 10 perfect erection whenever you want. You still ejaculate normally. It's discreet. Only really you and your partner may know you have it, but it's not something that if you're walking around, someone's just going to know you have it. So that's also something that we commonly do to help with erections. And sex therapy is something that I also really recommend, especially for psychogenic causes of erectile dysfunction. Sometimes if this is just something in regards to how you and your partner are relating, just different things. Sometimes it's important to kind of get an objective view and someone who can kind of help you navigate navigate that relationship. I recognize there's limitations on where you could find kind of good certified sex therapists, but also what's nice in this COVID world, there's a lot of things that can be done digitally via Zoom and online. So I have a lot of patients that are seeing therapists and, they're seeing them online with their partners. So hopefully as, we continue to be in a more remote world, all of these options won't be as hard to come by. I'm going to shift gears now to talking about an enlarged prostate, which I mentioned briefly when I was talking about, prostate cancer. But this is just also known as an enlarged prostate. And I mentioned before that this incidence increases with age linearly, so that the prostate just grows as you age. It rarely affects men under the age of 30, and even under the age of 40, very, very small percentage. this can cause your PSA level, remember that surrogate for prostate cancer, it can cause it to go up. It can also impact how you urinate. So I can probably bet for any guy here above the age of 50, either you or one of your friends has maybe mentioned that their urination has changed. That's normal. And that's just because the prostate, depending on how it's growing, sometimes it impinges on the urethra, which is where your urine comes out from. And so that can cause changes in your urination. Again, lots of things we can do for that. And it can be familial. There's some guys that, their family, they say, oh, my dad had to have his prostate shaved down, and, it can run in families. So it is something to be mindful of, again, as you're thinking about family history. But I also like to tell men that the factors that affect your urination don't necessarily correlate with size. And so I had a guy who had a prostate literally the size of a grapefruit, a huge, huge prostate, but he had no urinary symptoms. We saw it like on a scan that we were doing for something else. He had prostate, but he had no urination symptoms because his prostate, lucky for him, wasn't impinging on the urethra, that channel where urine was coming out from. So in essence, you can have a small prostate, but if your prostate is growing into that channel, you can still be very symptomatic from this. So size doesn't necessarily correlate with symptoms. And some signs and symptoms of an enlarged prostate include urinary frequency, so if you're going like every hour, even if you felt like you got everything out, urinary urgency, like you just can't hold your urine, you have to run to the bathroom. Nocturia is when you're waking up at night to go to the bathroom. Waking up once is not really seen as too problematic, but if you're waking up 2 to 3 times or more, that can be an issue. Pain with urination, straining with urination, an intermittent urinary stream, feeling like you're not quite emptying your bladder completely, and what we call double urination. So you go to the bathroom, 5 minutes later, you got to go back to the bathroom and get everything out. These are all signs that you may have an enlarged prostate. And lots of treatment options for this, as well. Also oral medications that help with this, that are, fairly easy to come by. Also, pretty inexpensive. Probably the most common one that guys may have heard about is something called Flomax. And that's something that helps to open up that urethra, that channel. The 5-alpha reductase inhibitors, I mentioned before, the finasteride and the dutasteride, those are medications that help with urination, but those are usually a little bit more limited because it can cause sexual dysfunction issues in some men. And so some guys either are too afraid to take the risk, or they've taken it and they want no parts of it. And all of these effects are reversible if you stop it, but it is, a known side effect. So I will always tell my patients to be mindful of it. Lots of surgeries as well. There are so many surgeries to shave down your prostate. I mentioned here UroLift and Rezum. Those are 2 newer treatments that really preserve ejaculatory and sexual function. So certainly those are usually the 2 I try to hopefully recommend if patients are good candidates for them. There's special kind of size and the anatomy of your prostate that makes you candidates for those. But we do, surgeries for these robotically, endoscopically, meaning we don't like do any cuts on you, but we actually use cameras to go through your urethra and shave down the prostate. And if you have a really huge prostate, sometimes we may have to even do it in kind of an open surgery fashion. But 2 important points to remember: a large prostate alone without urinary symptoms does not require treatment. And you also want to ensure that you don't have any concurrent bladder issues that actually may be the cause of your urination. So a lot of, and we usually are thinking it's a prostate, but if you have overactive bladder and other things, sometimes those are also things that we think about if we're not really making any progress, treating your enlarged prostate. And next, I'm going to talk about low testosterone. Kind of the term for that is what we call hypogonadism, another really common men's condition. And this is something that I really, struggle with my younger patients, because for guys that are trying to work out and bulk up and do those things, they somehow find testosterone at the gym and, at other places. And it's dangerous only because, especially if you're in your procreation years, if you just take testosterone, it actually completely drives down your sperm count. And if you don't know this and you're taking it, I have a lot of guys who've been dealing with infertility issues, and they're taking this testosterone that their friend gave them or somebody, and no one had the conversation with them. So some signs of low testosterone, if you're really having it, please see someone, because again, it's a medical condition that should be treated. treated. And that's something that you really want to be winging it without a medical professional. So some signs of low T, low sex drive, erectile dysfunction, poor mood or not feeling like yourself, low energy levels, poor sleep hygiene. Now, arguably, these can also just be signs of, you getting older. So not if you have like these symptoms, I'm not saying that you definitely have low testosterone, but it is a reasonable thing to look out for if you are experiencing this. Sometimes people, it's time, it's age, it's life. And so not everything that falls into these categories are necessarily, low testosterone. And besides low testosterone, you can also have lower levels of hormones that are made. Your pituitary gland is in your brain, and that's a gland that makes a lot of hormones for your body. And it makes certain hormones that also affect your testosterone levels. So those are all things that we also check for if guys, in fact, have low testosterone, because for me, I'm always trying to look for the root cause. You don't want to just be throwing medications at everything, but we need to really find out what the root cause is, because sometimes there are significant issues that people are unaware of, and we find that, and it kind of self-resolves some of these issues. Thyroid deficiencies can also contribute to issues with erection. So if you know that you have thyroid problems, also something to keep well controlled and treat, because we know that that can affect your thyroid levels. But low testosterone is the most common hormonal deficiency that we encounter, and it can be treated in a variety of ways. Back here, sorry. Okay. I'm not going to go into too much depth about the different ways that we, treat, testosterone deficiency, but I will say if those symptoms kind of, spoke out to you, I really encourage you to at least beg your questions to your doctor. And, there's topical gels, there's injections, lots of different ways to address it. But the most important thing, especially for my younger guys, if you're just taking testosterone without talking to someone, it is going to cause you to have fertility issues. And speaking of fertility, I'm going to end with the topic of vasectomies. This is also a point of contention among a lot of my African men and a lot of my patients here. If you have stopped having children, really no reason why you shouldn't think about a vasectomy. So it's a male sterilization procedure, typically done in less than 20 to 30 minutes. I do these in like literally 10 minutes. They're actually very straightforward procedures to do. Over 99% effective. And there's several reasons that men should consider this once they stop having children. And hopefully this is speaking out to the women on this call who are probably battling with their husbands about getting vasectomies so that they can either get off birth control and not have to get hysterectomies. So some advantages of a vasectomy. You can have unrestricted sex without the fear of an unplanned pregnancy, right? So, why not have the freedom of being able to have all the sex you want without getting someone pregnant? Female sterilization procedures are major surgeries, guys. So even if your partners or someone have gotten them done, it requires general anesthesia, and it actually comes with a lot more risks compared to just getting a vasectomy. If you were to get a vasectomy, it also means that your wife, female partner, if that, is who you engage with, they don't have to be subjected to a lifetime of hormones or birth control, which also has risks to their own health. It's also cost effective, one and done. And again, no need to purchase birth control and no need to worry about it. And I know, guys, biggest worry, it is something that's kind of tied to, your manhood, but vasectomies can be reversed, right? So your vas deferens, which is where the term vasectomy comes from, it's just a tube. So when you get a vasectomy, we're just, continuing a continuous tube, but you can actually bring it back together. I also do vasectomy reversals. And so if you really thought that you had it done, you change your mind, maybe you met someone else or you and your partner decided you want to have more kids, it's fairly straightforward to undo. Versus if a woman gets a hysterectomy, it's nearly impossible for them to restore their fertility back. So again, it's much easier to cut things off in guys, but it's also much easier for us to, bring things back together. So I put that as a plug for our couples out there who are struggling with this, because I do think vasectomies get a really bad rap. And unfortunately, some myths about it that I also like to mention to men, because this is also what I think prevents men from thinking about it. Vasectomies do not alter your sex drive. They don't have anything to do with your hormone production. It doesn't affect your erections. erections. They're not even in the same area as the nerves that are responsible for your erections. It doesn't change the size of your penis or your testicles. It doesn't cause cancer. And you are not less of a man by getting a vasectomy. I think a lot of these myths, unfortunately, have perpetuated themselves. And so I just like to reiterate, you will be the same person you were after your vasectomy, with much less fear around an unwanted pregnancy potentially. And as I mentioned before, it's not technically permanent. You can reverse it. Now, that being said, I don't want you to go into vasectomy just planning to reverse it, because it's a waste of your time and money. But it is something that, again, it can be done. So hopefully that's not something that makes it so insurmountable. So that is the end of all the conditions we talked about. I know we got through a lot, but hopefully, I hope you got a lot out of this in terms of things to think about, the men and women. And, when in doubt, never hesitate to, see your urologist for further evaluations. And, certainly if you're having trouble finding a urologist wherever you are, if you're not, I'm in Chicago, but, I know a lot of urologists. So certainly if you are struggling to find one, I'd also be happy to connect you with a colleague of mine. So thank you, and happy to take any questions.
Wow, thank you very, very much, Dr. for that powerful, wonderful presentation. I'm sure you've learned. I'm following all the conversations in the chat and those sending me private text messages. We've really learned. We still have that idea here for a while, so it's time to ask questions. You can ask directly by showing off your hands. If you're shy, you don't want to test, why not? You can test me. You can put it on the chat. However, we get the message, you want to it. So let's go with Clement from Clement. You can go ahead.
Yeah, thank you very much, Doc.
Hi.
I have 5 questions.
Hey.
You were listening. That's great.
Yeah, I have 5 questions. My first question is, does the frequency of sex protect the prostate? Is it true?
That's a good question. I get that a lot. So, your prostate is what makes most of your, ejaculate volume. So the kind of thought that came from that is that the more that you're ejaculating, the more that you're kind of testing the system or getting things through the system. If you were to have bad cells there, you're kind of, I would say that, you having more sex and having more ejaculations, there would be a very minimal advantage in terms of your prostate cancer risk. I mean, I deal with sexual dysfunction, so I'm a big proponent. The more sex, the better, but it's not necessarily going to be entirely protective from a prostate cancer standpoint. I do get that question a lot, so I appreciate you asking that for us to, put out there. But I think having more sex has more effects on your quality of life and your stress levels and other things, rather than your kind of straight prostate cancer risk.
Thank you. The next question.
Mm-hmm.
If the frequency is true to protect prostate,
Mm-hmm.
then wouldn't the frequency also affect erection?
No, it wouldn't. So, when you have an erection, you mean like kind of your ability to get another one if you're having sex, like back to back?
Yeah.
Not necessarily. I mean, I think if you have, pretty good, erections, I mean, like with anything, you're going to need to recharge a little bit, so, I mean, I think if you needed to kind of start a second or, or third round, any person, even if they have good erections, still need a little bit of time. So I hope I'm answering your question, but
what I'm saying is the pressure of sex, wouldn't that, if the frequency is increased, will affect erection?
It shouldn't. It shouldn't affect your erection because when you're thinking about, I guess, pressure from like the prostate, that's just the ejaculatory phase of when you're having sex, right? So your erections and your penis, it's a part of the process, but when you're actually, ejaculating, it's a separate part of the system that's actually, releasing for you to ejaculate. So there shouldn't be any effect whatsoever on your erection.
Okay, thank
Yeah.
you. The next question. Uh, Doc, do I have the floor?
Yes, others will ask this, and then you
Okay, I don't want to come back again.
come back.
Okay. Okay, Doc, I want to ask, what is the period uh, between erection and the second round? If you have a man is having sex and the first round is over, does the interval between the first and the second, if they won't, suggest erectional dysfunction?
Good question. So no. So when we talk about erectile dysfunction, it's really your ability to actually, get an erection. And I mentioned before, every man is going to be different in terms of their kind of recharge capability. I will say that your ability to recharge was probably much better in general for most guys when they were, 20 compared to when they were, 60. So I think that reasonable expectations as you get older, that time interval may be a bit longer, but if you're still able to get a good erection, like that's still good. But your body's ability to recharge in between rounds, that's really more a virtue of just, your body is getting, just a little bit, older, and that recoil, so to speak, it's not going to be as robust as when you were younger. But more importantly, if you can still get a good erection, that should matter more. So if you know that now, if that time period in between is, going to be a little bit longer, I would just, plan accordingly, but I wouldn't see that as a failure of you being able to get erections. That's more just, it's a time and, age related change, and it's kind of expected.
Thank you. My last one.
Mm-hmm.
Does is there any way to suggest that the penis can be increased above the normal size?
Also a good question. So I would say if you use so the vacuum erection device that I mentioned before, that can really help to kind of maximize your penis as much as you can. So the penis is not like when we think about implants, it's not like if people put in breast implants, right? You could take someone from, I don't know, an A to like a D, right? You can't really do that with the penis. And even though like I do like the penile implants, you may get a little bit of an increase, but I can only take you as far as your body can. So what I actually find with most guys, you can try to maximize it as much as you can with like a vacuum erection device, which is really a mechanical way of expanding the tissues and really getting it to its full glory. But for a lot of men, as they get older, really their stomachs are what's causing their penises to appear smaller. So when I examine a patient and I really push back their penis back to like the bone, I can usually get, like another, inch or so, inch or two by pushing back. So if you are struggling with a kind of a large penis and you're like, hey, I'm not seeing as much of my penis, it's not that your penis has gotten smaller, it's that it's involuting or it's being hit by your penis. And so with weight loss and exercise, and the more you kind of shave off your gut, you'll actually be able to see more of your, more of your penis. But in terms of like penile, like augmentation and things, it's very different from other kind of augmentation procedures because you only have so much space within your penis that people can put things in. And so I highly discourage people from injections and other things that people have used to try to augment their penis size, because often they're like materials like silicone and other things, and they're disasters because what they do is they actually will cause your penis to eventually scar down. And if your penis is scarred, if those chambers are scarred, no matter how good your blood flow is, you have now limited the expansion of your penis. And I've just seen that they're nightmare procedures to take care of in guys. And so I would just say, if you have a good partner that was happy with, your penis before, they're probably still going to be happy with it. And, the nature of your relationships, again, they change over time. But I would say if you really want to fully expand it, vacuum erection devices are great ways to, try to mechanically, expand it, and also just, weight loss if you have a gut.
I'm grateful.
My pleasure.
Awesome.
Thank you for the great questions.
It's a good plan. And the here as well. So the question that says that is pain for 3 continuous days a sign of a possible prostate issue?
Could you repeat that? It was breaking up a little bit.
Sure. It said is right balls for 3 continuous days a sign of a possible prostate issue?
Something, but I don't know. Something balls, you said?
Oh, so what it means that if you have a pain in your right testicles
Okay.
for 3 continuous days, is it a sign of a prostate issue?
Oh, pain. Okay, pain in the testicles. Not necessarily. So, in terms of if you have any inflammation or issues with the prostate, I usually see them in patients. They talk about their like urethra, like they have like just odd sensations, or maybe even like pain with like urination, or the tip of their penis just doesn't, quite feel normal. If you're having pain in your testicles, it could actually be, nerve pain. So some of the nerves that actually help with, erections and other things, they actually run. So if you touch the bottom, if you touch the bottom of your stomach, that bone that you feel, there's channels that have nerves running through that, and if you look at your scrotum, behind the base of the scrotum, there's nerves that run there. So if you're having continuous pain, that's something that I would encourage you to, see a doctor about, to see, but it could be inflammation in that testicle. It could be a nerve related issue. So I think an exam would be really important to tease that out, but I wouldn't think prostate. If you're having, one-sided testicular issue, I would first make sure that there isn't anything like structural, like a cyst or something. Again, unilateral kind of nerve irritations or neuralgias can cause that as well, and sometimes inflammation.
Gotcha.
Mhm.
Well, another question says, can erectile dysfunction be cured on its own?
Can it be brought on by its own?
Yes, can it be cured? Not cured.
Cured. Good question. So I think that depends on what the underlying cause is. So certainly for the psychogenic causes, if you identify what aspect of your sexual encounter is causing you to have changes in your, erections, and you address it, that can certainly be cured. If it's an underlying medical issue, the better controlled those conditions are, you can certainly help to improve it. But I would say cure is interesting when it comes to erectile dysfunction, because once you've kind of hit that point, especially if it's from another medical condition, you may always have a degree of it. But if it is well controlled, it may not be something that's coming, that's popping up all the time. So if you are, let's say, a diabetic, but your sugars are well controlled, you're maintaining a good, healthy diet, excuse me, it is possible that if you do all the right things, maybe, you may have issues with your erections like once in a while, but if you're not controlling your sugars, you're having a terrible diet, then that instance is going to come on, kind of more and more. So I think the better you take care of yourself, the better you can really help your body to minimize the number of occurrences. But I'd say once it starts kind of becoming regular, you can kind of mitigate it a bit, but it may not be something that totally goes away. But, I've seen, again, in some guys where, again, if it's, a combination of issues, they work really hard. I wouldn't go into it, especially for my older guys. I wouldn't have the expectation that it can self-resolve. I think the possibility of that happening is much higher for like the under 40 crowd, rather than, guys who are above like 40 to 50.
Thank you. Another question is, how important is groups for prostate cancer or erectile dysfunction? How important is support groups?
Support groups. I think support groups are great. If you have it, I think, again, these are conversations that more, that men need to be having more with each other, because I do think all it takes is one guy who says, hey, I had my rectal exam, it wasn't that bad. Or, I had my prostate checked, it wasn't that bad. And I think once people have more of those reassurances, they feel that they can kind of, get through it. I think when people are thinking of some of the horror stories that tend to, of course, circulate more often, I think that's what keeps people away. But I do think, if you have a a close circle of friends, have the conversation. I mean, I can almost put money that if a group of 65-year-old men, I can put money that most of the guys in that group probably are dealing with erection issues, right? And even though that's not something to may talk about, it could be something like, hey, did you go and see your doctor, or did you try this? There shouldn't be anything embarrassing when all guys are really dealing with it. But I also recognize that it is a sensitive topic, and so it's much easier said than done. But prostate cancer certainly can be really helpful, especially so that you can kind of share resources, right? Even depending on where you are, it is important for people to have open conversations about this, because unfortunately not all urologists are created equal. And I think that it's important for people to have these open discussions. So it's like, hey, maybe I got this done, or I tried this, and just to make sure all potential options have been discussed and are at the table. And unfortunately, I mean, even like with other medical conditions, not everybody is going to be getting the same bit of advice. So I think support groups are great if you have it.
Awesome. The question says, looking at how beautiful you are, how do you get men to respond to your diagnosis?
Great question. I keep it very, very professional. I mean, I think, of course, yes, I'm young. And I mean, honestly, most of the guys that I'm seeing are like my dad's age or my uncle's age. I mean, I think it's something that is a very real thing. But I really try to, frame it as, hey, this is a quality of life issue. And I get that, being cancer free is important. But I also think that having a high quality of life is important. So if having a good sex life and, if that's important to you, that for me, I think just makes people happier. I mean, the whole reason I, got into this subspecialty is because I think quality of life is just important, right? We come from a culture where family is important. So like infertility, right? It's something that, and I didn't delve into this, too much, but we still come from a society, not just Ghanaians, but like the world, where it's still put on the woman that they're the issue, but guys contribute are contributors to the issue 50% of the time, right? So it's something that when we think about, what is driving people, right? Like, I just think there's nothing more rewarding to me than helping people have better sex and make babies. Like, that's just something that makes me happy. And I think that comes across when I'm talking to my patients. And I think they can usually get over the fact that I'm like their daughter's age, but it's in general not too awkward. And I'm a pretty relaxed person, if you haven't gathered that too. So I'm usually able to dispel, any concerns or, points of embarrassment or anything like that. If you're confident in what you're doing, I think that speaks volumes, and men respond to that.
That's true. Great. And here is how many
Doc,
times yes, please.
Doc, we've been using frequent sex to avoid prostate cancer. So how come you've come to dispel that, take that away from us? Huh? We've been huh? Can that be re-recorded? Because now you've taken something away from us. Huh?
Sorry for all the men tricking your wives about prostate cancer risk. No, it's again, it's great quality of life. I mean, when you think about things that can cause you to, more sex, maybe you're less stressed out. So if your body is less stressed, your body is also going to be less likely to manifest cancers and other diseases. So I think it's not directly correlated, but in general, if you are less stressed, it is better for your health, in general. So I don't think I'm totally throwing you under the bus in terms of what you've been telling your wives, but it's it's still important. It's still important. And don't forget about your female partners too. Again, I didn't go into depth about this, but women's sex cycle, especially, premenopausal, and postmenopausal, they're also at different stages, but, just as much as men like sex, so do women. And so don't ignore your partners when it comes to sexual satisfaction and what is required for both of you to really be happy. I think women, unfortunately, are often ignored when it comes to this. And it really is because the industry, erectile dysfunction is a multi-billion-dollar industry. and female sexual dysfunction has not caught up with that, but it's real. So it is something that I encourage you, if you're have your partners on the call, or for the women out there, have those open discussions, because you may be having a really good time and your wife may be saying something different. So it's important to just be on the same page and just make sure you both are maximizing, your quality of life.
Awesome. Irene, you can go ahead.
Okay, good evening or good afternoon, everyone. Doug, thanks very much for your presentation, and I'm happy to learn that vasectomies can actually be reversed. It's my first time hearing that. And now the question I want to ask, when it comes to women's health, there are a lot of population level programs that address, let's say, cervical cancer. You see people having a day for celebration of cervical cancer, mass screening exercises. When it comes to men's health, let's say prostate cancer and this erectile dysfunction issues, are there population level programs, or are there organizations which are into men's health, especially in low resource settings? Or are there researches that go on? For instance, clearly when you talk about men's health, men sometimes find it difficult to come out to answer questions regarding their men's health. So are there population level programs or researches that are being carried out and surveys, and how easy it is to go about such programs?
Yeah, that's an excellent question, Irene. I'm so happy you asked that. And I think, that really speaks to the fact that I think women are way ahead of the curve when it comes to advocacy and awareness around our conditions. So you're right. Most people can think of there's breast cancer walks and, now cervical cancer, women's health. I think women are much better at forming these large organizations and advocating for ourselves. And I think men, unfortunately, by virtue of them in general not seeking healthcare out as much, it has played out in policy and these big awareness groups. It's actually something, at least stateside, that I work on with our urological association, because I do think that men's health is often falling by the sidelines. But then the caveat is that in society, government, other things, men in general are in more positions of power. So it's an interesting dichotomy to see that, men who are in general in more positions of power compared to men, when it comes to healthcare, they are not ahead of the curve, and, women are. I think, at least to start, the American Urological Association, which I mentioned before, which is like the biggest urology organization, we do actively lobby and have other kind of political stakes in trying to get more awareness around men's health conditions. As for some of the more specific ones, like prostate cancer and even sexual dysfunction, there are organizations that do have, patient-specific handouts and, even virtual sessions. I mean, now in the virtual world, there's a lot of opportunities for you to attend, sessions like this, where you can really, at least in a more comfortable or less nervous setting, get these questions answered. But I agree, we are not where we need to be when it comes to kind of larger awareness groups and events. And that's something I'm certainly actively working toward. I can try to think a little bit more of some other specific organizations, but even in Ghana, for example, I mean, this is something that I'm also really trying to, push for and see how we can more effectively have more awareness and more groups that talk about this, because it just is not where it needs to be. But thank you for your question. It's well noted, and I think it's something that we do need to work on.
Awesome. Good answer. Now, question here. Maybe William, go ahead and ask your question first before I go on to read. You can go ahead.
Okay, thank you, Doctor. Thanks for the presentation. I'm happy also to hear that vasectomy can be reversed in the first time. I have two questions. One, I'm told that when you go to vasectomy, you bloat. You go fat. Is it true? That is number one. Number two, also I had a friend in the UK who went through vasectomy, but he was able to impregnate the wife. Why that? Thank you.
Okay. Can you repeat your first question? I didn't quite hear it. There was a little bit of feedback.
Yeah. So sorry, I'm in a noisy environment. I'm asking that respect of vasectomy for you to put on weight?
Okay. I would say there's certainly no evidence that you would put on weight after a vasectomy. There's no link there. So I think that's probably, I may have to add that onto my list of myths because that isn't linked. And I think for your friend who is still able to impregnate, their partner, I think they just didn't have a good vasectomy. So when you get a vasectomy, you actually are supposed to get a confirmatory you're supposed to get a confirmatory semen analysis to show that you don't have any active moving sperm in your ejaculate. So you still have ejaculations when you have a vasectomy. There's just no sperm in it. But we do check it at least twice after you get it done to confirm it. So perhaps your friend, got it done, didn't double check that it was actually, confirmed, and then he was able to impregnate his wife, which is really unfortunate, especially if they, took the step to try to avoid that. But you do have to check. So I would have to, there may have been something there where it wasn't checked on, the proper channels that usually are done to prevent that and ensure that there's no sperm were clearly not taken. But I'd say that's the exception and not like the rule.
Thank you very much. Another question says here, how many times should a man be involved in sex within a week?
There really is no number. I think it's preference. There's certainly no number that you quote unquote have to be, engaged in sex. And, that number varies. I mean, there's a lot of very happy couples and the norm is, once a week. Others, it's more often. I mean, I think it really just depends on, your partner and, what you guys find to be your optimal, frequency. But there isn't like a certain number that means you're normal or not normal. Everyone also at baseline has different, sex drives. So if you're well matched with a partner, you both have kind of moderate or, lower need to have a lot of sex, then, that is something to take into account. But there's no definite number. And that may have to be my last question. I have to head to the hospital. So.
Gotcha.
Great question. This was really, I really had a great time. I think it's interesting from my perspective to see what people talk about and what's out there, because I think you don't know until you ask. And even someone saying they didn't know vasectomies could be reversed. I mean, it's really important to have mediums like this where you can get questions out there and, dispel those myths.
All righty. Thank you so much. We are so grateful that you squeeze part of your busy schedule to talk to us from around the world. We have people from all over the world, from Ghana, from Uganda, from the United Kingdom, I see from Kenya, Cameroon, the US, and all over the place. It's really a blessing to have you, and thank you for all the amazing work that you've been doing and supporting the Ghanaian and African communities around the globe. We are so grateful. So at this point, Amma, I don't know if you are available to give us the vote of thanks. That would be awesome. Let's see if we have Amma available. Okay, so if Amma is not available, I'll ask Caroline if you can give us the vote of thanks.
Thank you. And thank you so much. I think this, again, this platform and this, event is so well placed. We just finished November is Men's Health Month. And so a lot of these were, good timing in terms of able to discuss it, but we need more platforms like this for men and women to learn about this. So I appreciate you having me to talk about this.
Thank you very, very much. Thank you very much. All right, so it looks like, so Caroline, hello? Yes, I know you are available. Yes, if you can give us a quick vote of thanks so that we can run to the hospital.
Yes, just a minute. Hi, thank you, Dr. Denise, for your time. It was very, very informative. It's a very important topic. Can you hear me?
Yes.
Yes, we can.
Yes, it's a very important topic that we recognize today. We appreciate the work that you have enlightened us in the various topics, very critical issues in terms of family, in terms of in our relatives, in our families, and in the society as well. We appreciate your time. And most importantly, we want to recognize the work that you're doing. We appreciate. And we hope that we will invite you again in another session and maybe talk about the ladies' dysfunction. Maybe.
Ooh,
Yeah,
yes.
we will see that for next year. To be nice to reach us also, as we
Yes.
also support one another. I don't have much. I want to say thank you and may you be blessed. Everybody that has joined in today, thank you for your time. Thank you, Jagils Institute, for offering this platform. And thank you, Dr. Jacobs, for being the host and the coordinating the session. Thank you.
Thank you. Thank you very much, Caroline,
Bless
all the way
you.
from the Netherlands.
Yeah. Oh, wow. Okay.
Yes, she's our alumni vice president.
Oh,
Thank you so
okay.
much for your support. And thank you, Addis-Ababa Old Boys Association, Dr. Leo Writer, Aaron Abuaji, and Dr. Kofi Gwedo and the team. Thank you all for partnering and making this possible. Doc, once again, we are grateful and thank you very much.
Thank you as well. Everyone have a blessed day. Thank you for having me.
All right. Bye-bye.
Thank you all. Bye-bye.
Bye-bye.